Assisted reproductive technology includes all fertility treatments or procedures used to help individuals and couples with fertility issues conceive a child. There are several types of assisted reproduction technology procedures, each with its own advantages and disadvantages. The choice of method depends on many factors, including the underlying cause of infertility, the age of the prospective parents, their overall health, and other personal and ethical considerations. In this video, we will discuss the two main techniques. So, how do artificial insemination and in vitro fertilization work? Let me explain. In a fertile couple, conception typically happens as follows. After sexual intercourse, which, for obvious reasons, will only represent symbolically here, at least one sperm cell from the male's semen reaches the female egg inside the woman's uterus, fertilizes it, and the fertilized egg attaches itself to the uterine wall, beginning its development into an embryo. However, if conception does not occur after several attempts, usually due to physical or psychological health issues affecting the man, the woman, or both, some people choose to turn to assisted reproductive technology. The first procedure we'll discuss is artificial insemination. Here's how the process generally works. The woman first undergoes ovarian stimulation, a procedure in which medication is used to increase egg production. During a typical menstrual cycle, a woman releases only one egg at a time. Ovarian stimulation aims to produce multiple eggs to maximize the chances of conception. Throughout the stimulation process, the woman undergoes regular ultrasound scans to monitor the growth and development of the ovarian follicles. Meanwhile, the man provides a semen sample, which is processed in the laboratory to isolate the highest quality sperm, those that are healthiest, most motile, and most viable, from the other components of the semen. Once the eggs are ready, insemination is performed. The selected high-quality sperm sample is inserted directly into the woman's uterus using a thin catheter. At this point, all that remains is to wait and closely monitor the woman to check whether conception has occurred and pregnancy has begun. However, when this or other techniques fail, or in cases of severe male or female infertility, couples may opt for in vitro fertilization. The process is similar to artificial insemination, but involves additional steps. It also begins with ovarian stimulation to obtain multiple eggs, increasing the chances of successful fertilization. Once the eggs are mature, a minor surgical procedure called follicular aspiration is performed, using a fine needle inserted through the vaginal wall. The eggs are retrieved directly from the ovaries. At the same time, the man provides a semen sample. After collection, the eggs and sperm are placed together in a laboratory dish, where the sperm naturally fertilize the eggs. The fertilized eggs, now called embryos, are then cultured in the laboratory for several days. During this time, they are carefully monitored to ensure they are developing correctly. One or more embryos are then transferred into the woman's uterus using a catheter. If the embryo successfully implants in the uterine wall and continues to grow, the procedure is considered successful. Often more embryos are created than are implanted. These embryos may be donated to other couples, used for scientific research, or discarded. However, they are frequently preserved for future use through a technique known as frozen embryo transfer. This allows previously frozen embryos to be used in later attempts, without repeating the entire ovarian stimulation and egg retrieval process. It is important to note that in vitro fertilization does not always succeed on the first attempt, and multiple cycles may be necessary to achieve pregnancy. There are also risks and potential side effects associated with the procedure, such as adverse reactions to ovarian stimulation medications, an increased risk of multiple pregnancies, and a slightly higher risk of birth defects. Finally, it's crucial to understand that all assisted reproductive technology procedures can be very expensive and emotionally challenging for the individuals or couples involved. Therefore, it is always best to have a serious conversation with a healthcare provider to fully understand the potential risks and benefits. Seeking psychological and emotional support throughout the process is also highly recommended. If you liked this video, like it, share it, and tell us in the comments what topic you'd like to learn about on this channel. We'll make it simple for you. And if you want to help us make more and more videos more frequently, you can do like our followers on Patreon and visit patreon.com/makeItSimpleVideo and help us with a donation. In exchange, you will always receive a reward, and your name will appear in the final credits of our videos. Thank you all, and may the iguana be with you.